Alternative provision, it's where education is made alternatively. When they talk about provision, they're talking about educational provision in this sense. It's not anything else. It's talking about where education provision is made alternatively than in a school building or on a school site. It's different to EOTAS. It's different to elective home education. I'm not going to be talking about EOTAS or elective home education now. We'll do in another clip in the future. But today we're going to be thinking about alternative provision. There is a duty to provide alternative provision or alternative education, as I prefer to call it, if your child is of compulsory school age, but is not receiving education because they're being prevented by illness from being able to attend school, they've perhaps been permanently excluded from school, or any other reason. And if that counts, if your child is unable to access their education in their school setting, then the local authority has an absolute duty under Section 19 of the Education Act 1996 to secure suitable full-time alternative education for them. That duty is most definitely with the local authority, not with the school, although local authorities and schools can often disagree about that. It's not uncommon for local authorities, when you request it, to tell you that it's the school's responsibility, and then the school, when you go back to the school, to tell you it's the local authority's responsibility, and for you to kind of play ping pong between the two. But the legal duty is most firmly with the local authority. The key word really when thinking about this is that your child is being prevented from attending school, right, through illness, because of permanent exclusion, or any other reason. So if they're being prevented, they're unable to attend school, they cannot attend school, you're going to need to evidence that. The proof will be down to you to provide that they cannot attend, rather than that they're choosing not to attend, or that you as their parents are choosing not for them to attend. So with so many things, special educational needs, it's getting that evidence that is the crux and the really difficult thing, because until you've got that evidence, no matter how unwell, damaged, difficult it is for your child, you will be expected for them to attend school. So evidence can come from usually medical professionals, often consultants, GPs, AMs. It's usually someone medical, certainly if it's for illness, and that includes mental health difficulties, then it needs to be a medical professional saying that. It could potentially be another sort of professional, social worker maybe, but it's unlikely to come from anyone else. It can be NHS evidence, or it can be private evidence. Evidence is evidence, and it doesn't make any difference. But without that evidence, then the school or local authority must take steps to ensure that the child attends school, and that includes considering fines and even working towards prosecution. So the evidence is key. You know, it is evidence that your child is not able to meet school that's going to stop those sort of normal school systems for non-attendance from continuing. So once you have that evidence that your child is unable to attend school, the first thing to do is to present it to the school and ask them to make suitable arrangements for a suitable alternative education to be provided. Give the school some time, a week, if you haven't heard anything within that time. Or if they've refused, if they have come back to you and said, no, we can't do that, or maybe they've come back to you and said, it's not our job to do that. At that point, either after 7 days of nothing happening, or as soon as you get a no or refusal from the school, then you need to make a formal complaint to your local authority that they're failing in their duty under Section 19. The way to make a formal complaint is documented in our YouTube channel, but it's using the local authority's online complaints process. It's really important that you don't let that stage drift. You'll see in the group, and some of you may have experience of children being unable to attend school with nothing happening for months, sometimes years. It's not uncommon, but pushing it through the local authority's formal complaints process at the first stage is likely to lead to the fastest outcome there. So alternative provision or alternative education is education that's not provided through a registered school. Local authorities do prefer children to remain on school rolls and for the school to fund the alternative provision, because this means that the school takes responsibility for ensuring that the quality of the education that the child's getting off site is good enough, the health and safety is good enough, all the safeguarding checks are in place, and that the child is attending and doing well. AP, alternative provision or alternative education, can differ significantly depending on the age, the interest, and the ability of the child. I can't just kind of give you a one size fits all of what it is because it's really flexible and it can be anything. It can include face-to-face or online, individual or small group teaching. It can include attending a setting, a different type of setting from school, so perhaps a forest school or a farm school. It can include therapeutic provisions. Some of them might be through the medium of computers. An example of that would be MindJam. Some of them might be therapeutic provisions through animals. An example would be equine therapy, or perhaps through music or through art. Education centred around sport, music or art on a more curriculum basis can be provided, or any other interest for the child. And for older pupils, vocational studies, sometimes even at an FE college on a 14 to 16 programme, such as bike mechanics, carpentry, early plumbing skills, that can form part of an alternative education package. The local authority's duty is to provide full-time suitable alternative education. Full-time is considered 25 hours a week. But this cannot be provided by one provider. If one provider were to provide more than 15 hours, then it would be considered a school and it would need to register as a school and then be named as the child's school. They'd have to go on to roll there and leave their school. So alternative provision for 25 hours would need to be provided by at least 2 different providers. But it's not uncommon for a child to attend school some of the time and to attend alternative education some of the time as well. There's a number of government guidelines that have come out that are helpful. One of them you might have seen me post about this week because it only came out in August and it is actually very helpful. It puts, and there's a really useful chart in there. It's in the group and it's on our business page. Really useful chart that tells you exactly what the parent's responsibility is, what the schools is and what the local authorities is. There's no wriggle room in that chart. And if you've got a school telling you it's the local authorities and a local authority telling you it's the school's responsibility, that chart will help you. Also, IPSI have got some really useful guidance. There's links on the slides here and we'll make sure those links go out into the group today so you can find them if you need to. But that's a whistle-stop tour. I hope it's been helpful of alternative provision.